Oh, it's a couple of hours
Okay.
drive, but the thing is, it's quite busy, and I've got a lot of work on looking after my husband and stuff. So, I mean, that's not that I don't want to come down more, but
Yeah.
I've got to get back up there quite soon, actually.
Okay.
So,
And you've just come down today, just came down as normal and found your
yeah,
your
well, I
dad
come
in
down. It's probably
bed?
about 6 months ago when I was last down, wasn't it? And
But you hadn't rung Angela and asked her to
No,
come
she
down?
was going to visit today. And
Dropped in.
I had to let myself in. He couldn't get out of bed to let me in. So, I mean, I don't
Yeah.
see how he can possibly manage on his own when he can't, get out of bed or anything.
Right. So, Mr. Miller, how old are you?
I'm just 71.
71, just
Yeah.
71.
Yeah.
And you live on your own, do you?
Yeah.
Okay.
Yeah, since my wife died.
Oh dear, how long ago was that?
About 5 years. something
Yeah, it's
like
5 years since
yeah.
Mum's been
Right.
gone.
5 years.
Okay. And are you normally fit and well? Have you got any?
Oh, he's pretty
I'm
good
fine.
usually. This isn't like him at all. This
No.
really isn't,
Which is why we didn't need to call you, I'm sure. But
Okay.
He
Yeah.
did.
Do you see your doctor regularly for anything at all?
no,
Oh, he
I
doesn't like to trouble them, no.
had a
No.
chest infection a year or so ago, but I'm
Right.
fine. I'm fit and healthy just at the moment. Just
And
don't want to get out of bed.
Okay. And no tablets?
No, he doesn't take any tablets, no. He's
No.
Right. So tell me a bit more about this not wanting to get out of bed. What do you mean by that?
I just don't seem to have any energy. I find it very difficult to stand up and actually put my legs on the floor.
Right.
Well, you
How-
can see, Doctor, he's not well, is he? I mean,
Let me just ask a few more questions about
Mhm.
quite what it is. I don't think I've got quite a good grasp just now about what's been going on. So how long would you say you've been feeling like that?
3 days?
3 days. 3 days of feeling, is it a kind of washed out feeling,
Yeah.
or are you feeling physically weak?
No, I just feel, I suppose it's both really. I just feel totally washed out. I just don't want to get up.
Okay.
Have no energy.
but can't they find out what's going on in hospital?
I certainly don't need to go to hospital. That's
Okay.
ridiculous.
You
So
can't manage
it's
that.
not that you're feeling weak in your legs or in your arms at all?
I just generally, it's not specific anywhere. I just feel yuck.
Right. And have you been able to get to the toilet?
No.
No. So that's, how have you been managing that?
Well, I've
Goodness only
I've got some
knows.
bottles that I can manage to get to the edge of the bed and
Right.
pee into a bottle. But,
Okay. And what have you been doing for food?
well, I've got some biscuits.
Just some hobnobs?
Yeah.
He's not eating or drinking properly. I mean, you can't stay alive on hobnobs, can he? That's why.
But I knew she was coming, so I'll
Right.
be all right. Now she's here. So.
And prior to this 3 days, who was doing the cooking, the shopping,
Me.
the cleaning? And this happened
Absolutely.
just suddenly?
Yeah,
You
yeah.
just
Yeah.
woke up one
It's
morning?
totally
or-
unlike me. Totally unlike me. I just didn't. I woke up one morning and I tried to get out of bed and I
Okay.
didn't want to.
And do you have a cough at the moment?
No.
A headache?
No.
Do you feel feverish at all?
No.
Any stinging or burning when you're passing water?
No.
No sickness or diarrhea or
No.
anything like that? And no pain in your legs, in your back?
I've got a bit of a pain here
Right,
and sort of down at the bottom of my tummy.
right.
See, that's why he needs to go in. You've got to get to the bottom
But
of
that's
it.
just because I haven't actually been able to go to the loo properly
Okay,
for a few days, so I'm sure that's what that is.
right. When you say go to the loo, you mean back passage or wheeze?
Back passage.
Right,
I've done wheezes, no problem.
right. So you're a bit constipated or
I just haven't been able to get out of
can't
bed.
go to bed, can't go to the toilet at all?
No, I can't get to the toilet.
Right, okay. And have you been losing weight recently?
Not that I'm aware of.
Right, okay.
He just doesn't well though, does he? He's short, Dad.
And who is living locally who supports you or who could support you?
I'm very independent. I've managed perfectly well on my own. I've got really nice neighbours. I mean, they're quite old, and I suppose if I needed to, I could ring up and ask them to come in.
But Dad, they can't look after you. Come on, we've got to be realistic here. They can't look after you, and I can't stay. Even though if I wanted to,
I just
I
need you
can't.
to give me something just to make me feel better
He needs
again.
to go into hospital.
Although I'm finding it difficult to know exactly what it would be that would make you feel better, because everything's quite vague at the
I
minute.
was hoping you could tell me.
Okay. Right. Let me just gather my thoughts. So what is it? So you don't seem very concerned, Mr. Miller. Is that right? I mean,
Yeah, I'm sure I'm fit and healthy. I'm sure I will get over this. I just
Right.
need, I don't know, a tonic or something to lift me up and get me out of bed again.
And he's stubborn and independent, of course. Well, I get it from Dad, isn't it?
Fair enough, but
So you haven't got any particular concerns about what might be going on,
no.
but your daughter's very concerned.
Well, she's concerned to find me in bed, but
Yeah, it's not like him at all to find him in bed, you know. He
Okay.
doesn't stay in bed.
Okay.
That's why I think there must be something going on.
All right. So were you concerned that it was anything in particular?
Well, I mean, he said about when you came in, you said you had that pain, didn't you?
yeah.
In your tummy and,
Yeah,
and
back
on one
here.
side as well.
Okay.
Don't know what that could be.
All right. I think at this stage it would be good to have a look at you, you know, examine you with my stethoscope and
Right.
feel your tummy and that sort of thing, listen to your chest, maybe take your blood pressure and have a look at your legs and see if I can see anything abnormal.
Okay, why do you want to do that?
Because I don't think that we've really got to the bottom of what's going on. So I think
Okay.
if I just have a little look at you generally and see if I can check that your legs are working okay and your arms are working okay.
Okay.
You can assume that his tummy and his chest and his neurological system is normal.
Right.
There's nothing abnormal to find when you did your examination, I think.
Okay. All right. Well, I couldn't find anything on examination. Everything seemed to be normal. Now, I think it's very difficult in this sort of situation when we've got a gentleman who's normally fit and well, but for some reason isn't finding it easy to get out of bed. And you're right, it could be something that's just going to pass off. And you're right in that it could be something quite serious.
Mm.
And I think there's the immediate concern of finding out what it is, as well as making sure that while we're doing that you've got an adequate diet and someone can help you go to the toilet and all that sort of thing. Now, what is it about going to hospital that's worrying you?
I'm worried I won't come out.
Right. Why is that?
Well, you hear so much about hospital diseases, MRSA or whatever it's called. I don't want to get that. I
Right.
don't think I need to go to hospital.
Right.
But Dad, you can't manage. And I can't stay.
Well, if I can make a suggestion, I think there's a couple of ideas that we could kind of knock around together, because I do think that you obviously need a bit more help at the moment if your daughter's got to get back. And as I said, there's the social concern. Now, if you really, really don't want to go into a big hospital, there is the option of the cottage hospital that we could think about, that's, you know, just down the road in the local town.
That's the same.
That's just manned by the GPs.
Couldn't a nurse come in or something? Just to,
Absolutely. So that was going to be my other idea, is that we could get a package going. There is something called Rapid Access. So that's physios and OTs and nurses.
sorry, OTs?
Occupational therapists.
Right.
So while, I mean, I can organise some blood tests and that sort of thing, x-rays, but I think it's going to be very difficult to kind of get those sort of tests done with you at home on your own. So I think from my perspective, it might be easier to do those things in the cottage hospital where everything is kind of there, but you're managed by the GPs and it's easier for people to kind of visit.
And Dad, we need to find out what's going on, don't we?
I understand that, but I really don't want to go into hospital if there's an alternative.
Okay, I mean, I obviously can't make you go into hospital, so we have to kind of work together. But you have to be prepared to see that I don't know what's going on, and it may take a while for me to find out. I mean, what I can do is ring the district nurses just now and give them a ring and ask them to come in, and they'll help you with your kind of toileting and that sort of
So
thing.
they can't be there every time you need to get...
Come in.
Hi.
Hi there. Yeah, please do come in, yeah.
Thank you. Hi, good to see you. It's Rona Clark.
Hi, Rona. Mark Kingsman.
Oh, thank you. Just really wanted to have a chat with you about Graham Williams, about losing blood PR.
Sure, yeah. I got a message that that you want to talk about Graham. That's absolutely fine. Do
Thank you.
tell me the story.
Well, yeah, I must admit I'm new to working in the area, and I was at, I think, Red House, one of the severe learning disabilities units.
Sure.
I was there attending another resident, and one of the female health professionals came up and showed me Graham's pants that had bright red blood in it.
Sure.
I went to see Graham to suss things out, but I don't know, I'm just not quite happy about the situation, really.
Right. And when you say you're not quite happy, what's going on?
Well, it's sort of, I think I'm quite confident physically. He seems quite well. He's not vomiting, you know, he's eating. I believe he had breakfast that morning.
Right.
But when I sort of
So
asked,
have you met him before? This is
no,
the
I
first time you met
haven't.
him?
No,
Okay.
and the female health professional, I don't think she's new to working, you know, in the unit as well. But
Right.
I sort of asked him, you know, what he could understand about the blood, and
Sure.
he just, on his sort of repetitive nature, just kept on saying, "Oh, I've been hurt there."
Right. Okay. Just to go back a little bit, you said that you didn't think there was any problem of a physical nature, so he's not been injured or he hadn't had a history of a fall. There was nothing in the accident book.
Not at all. I mean, I felt confident. He seemed quite well. He's
Yes.
eating. I think, you know, his bowels have been regularly open, and no other sort of physical symptoms I could see.
Okay, and he's not been complaining of tummy pain particularly,
No.
and he's not been losing weight or
No, nothing like that.
and he's not been sick, as you said.
No.
Do you know much about his situation, about his family, who's around, and
Well, I did make a few inquiries. His family live out the area, and I think there's little communication, to be honest with you.
Right, so they don't see him very much.
Yeah, he lives there permanently.
And do you know how long he's been there? He's been, sorry, it does say here, he's been there for 5 years.
Yeah,
Right,
so I've been
okay.
there quite a while. So
And do you know much about the history in the past 5 years that he's been there? Has he ever had a problem like this before?
not that I'm aware of. I mean, he had no sort of past medical history in terms of that I could see.
Okay.
Um,
So, just going, obviously you seemed anxious when you came in, and you mentioned that he said he hurt himself. He's been hurt down there. Is your concern that somebody has hurt him or abused him?
well, it's just a hunch, and of course I've got really limited evidence. It's,
Sure.
I don't know, I hope I'm wrong, but I do have suspicions that potentially it could be a member of staff or even a resident that could be causing harm, but I do have
Right,
really limited
okay.
evidence, and it's just
So
a
obviously it's
hunch,
really difficult as you're new.
Yeah, absolutely.
Mm. And you've obviously come to me. Have you spoken to any of your colleagues or anybody in the district nursing team who may have been in or knows him in the past or anything like that?
No, I don't think anyone's sort of really been into the unit much, so hence I was coming to you really just to ask for your advice really and
Sure.
support really.
I mean, you said advice and support. Is there anything else specific that you want from me?
Well, I think it's for me, I've got a hunch, I hope it's wrong, but it's in terms of next steps. I sort of feel that we kind of need to investigate it a bit further.
Sure. And in your ideal world, what would you like me to do? Would you like me to go and see him? Or?
I think for me it'd be great for you to come along with me to go and
Sure,
see.
to go and do a joint visit.
That's right, and to see, you know, hopefully.
Did
there
you
was-
examine him in any way? I know you saw the pants. Did you actually have a look at his tummy, or would he? It's quite difficult, isn't it?
Yeah, and I didn't quite feel comfortable with doing that really because
Yeah.
I couldn't quite gauge his level of understanding as well.
Okay.
All it had this sort of repetitive nature. I've just been hurt down there, so.
So we need to come up with a plan of how to proceed. So we'll definitely go and do a joint visit. Do you think we ought to involve the family?
Be useful, although there's a limited contact.
It's very difficult to know which way to go, isn't it? If we involve the family early, then we might be accusing the home or something of something that's not right.
True. I don't know. What do you think?
Yeah, I think we definitely ought to go and see him. Perhaps if they haven't had so much contact, perhaps we ought to investigate a bit more ourselves. Just make sure that there isn't a physical problem. It sounds unlikely, but you know, if he'll let me, then examine his tummy and see whether there's been any further occurrences. Look, perhaps at what has happened and what's been documented from their end. It's interesting that this young carer is new as well.
Yeah, she's only just arrived as well, and I believe she hasn't seen it previously.
I mean, it would be interesting to form a relationship with her and see exactly what her concerns were and what the best way to proceed. Okay, what sort of time frame would you like? What's your arrangements? What's your shift? Do you want us to go tomorrow or?
Well, I mean, I can be flexible really. Tomorrow will probably suit me quite well of an afternoon actually.
Okay.
But if that, suits you, I guess it'd be nice just to clear it up really, the concerns that I have.
And if we do suspect abuse, what would, in the district nursing team, what would be the line on that? Would you want us to handle it, or?
Well, I think some support really in terms of looking at the options, and I don't know whether, in terms of this learning disabilities, is it worth getting sort of an expert involved? I guess I'm asking your advice. I have never come across this scenario
No, this
before.
isn't something that I commonly dealt with myself. But
Okay, well.
but yeah, I mean, ideally, we would need to. This is very serious. If it was abuse, and we would need to take this very seriously.
Hopefully, it's not.
And he's 18, but
Yep.
but obviously still effectively doesn't have capacity, so would be a minor, and so we would need to be very, very specific the way that we do it and get some advice and proceed from there. Is that so? We'll do a home visit. We'll perhaps speak a bit more to the carers. We'll get some more information. Is there anything else that we ought to do? I wonder.
I think those are the initial bases, I guess. And you think that was probably the right route to go down?
Yeah,
so.
sure. I mean, was there anything else that you had in mind? You didn't have anything else you wanted me to? I mean, I know you're new, so you're perhaps not feeling part of the team. You don't know me.
Well, I guess, yeah. I mean, I came to yourself in that sort of getting to know the team and who's who kind of
Sure.
thing. It was just really to ask your advice and support with how to best move forwards. Really,
Sure.
that really.
And I'm delighted you have come to me, and certainly we need to take this forward, and you must feel that you can, come in and have professional conversations. And
Yeah,
I know that district nurses aren't employed by us, but it's there should not be any barriers, although at times there can be. So.
No, I appreciate that. Thank you very much. It'd be great to sort of just be able to follow it up really. And I'm hopefully I'm wrong, and there's no suspicions
Sure.
there, but it'd be good to.
It's always difficult, isn't it? Because you're never going to get 100% evidence,
You
are
don't want to be
But,
seen as over dramatic either. So.
No.
Okay.
But
thank you.
as long as we can get enough evidence from a visit, and if we can't, then perhaps we need to come up with some sort of joint plan of how we jointly follow this up and make sure that we don't lose them to follow up, so that we can visit as and when we need.
Yeah.
Is there anything else anything else that you were hoping I was going to do?
No, I think to be honest, the primary thing was to come with me actually and to have your opinion and
Sure.
and hopefully be able to cover a bit more information.
Yeah. Okay.
So,
Well,
thank you.
let's book an appointment. Let's organise a time for a joint visit tomorrow.
Okay.
And perhaps we'll speak if we possibly can. I don't know if you could contact the carer and just see if there's been any changes.
Yeah,
When was that? When did you actually see him last?
It was actually yesterday, and I did
So
say to
there's not
Lee,
going to be much change.
if there was any other change for her to contact me.
Do you know anything about the setup? Who's in charge? Is it an agency that runs?
Well, the manager wasn't there actually that day, and of course it's my first time I've been to actually that unit, so I'm afraid it's quite limited.
So we ought to probably arrange a meeting with the manager at some point.
I will ask some of the other DNs if they've had any experience in the unit as well.
Sure.
All right, well thank you.
Okay.
So tomorrow it'll be good to take that forward.
Pleasure. Okay.
Excellent. All right, thanks
See you
very much.
tomorrow. Nice
Thank
to
you.
meet
You too.
Bye-bye.
Bye.
Hello. Your next consultation will be a telephone consultation.
All right.
So if you'd like to get your paper, your pen,
Yeah.
come through to the room, and when you get there, read the instructions that are by the telephone.
Okay.
Thanks very much.
Hello, it's Dr. John here.
Oh, hello, this is Mrs. Jones. I'm phoning up about my daughter.
Oh, hi. Hi, Mrs. Jones. Can you just tell me your daughter's name and how old she is?
Yeah, it's Ruby Jones, and she's 4 years old.
Okay. And why have you rung up today?
Well, I'd like someone to come and see her. She's got a terrible rash on her face.
Oh, okay. Sorry to hear that. How long has she had that rash for?
Oh, only a couple of days. It's like a really bright red rash on her cheek, so obviously I'm a bit worried about it.
Yeah. Are you worried about anything in particular, or just generally?
Well, first of all, obviously I thought meningitis. That was the main concern.
Right.
But I did do the glass test, and the spots seemed to fade. So I'm
Okay.
guessing that's okay.
All right. Just it sounds like you've done the right thing. Can you just tell me exactly what you mean by the glass test?
Well, she's got a few sort of red spots on her arms as well, so I put the glass over her skin, and I just read that if the spots stay there, it could be meningitis. That's what I was testing for.
Okay.
But it didn't, it faded away.
Okay, so you pushed the glass on, and then the skin went to a normal colour.
Yeah, yeah.
Okay, all right, well done. That's a very important. That's a very reassuring sign for me to hear. Yeah. Okay. So she's got spots on her arms and legs, did you say?
Yeah, yeah.
And she's got these bright red cheeks.
Mm-hmm.
Okay. And that's just been for, sorry, how long?
A couple of days.
Okay. And how is she in herself?
She's actually fine. You know, she's
Right.
been up and about and playing. She doesn't actually seem ill as such. It's
Okay.
it's just a rash.
Yeah. Okay. And so she's eating and drinking and
Yeah.
doing things all right. She's happily playing. She doesn't.
She's fine.
She hasn't vomited at all.
No.
No. Okay.
I have kept her off school, but
Right.
she seems fine.
Yeah. And she hasn't had any fevers recently.
No.
No. Has she got any other illnesses?
No, she's fine.
She's normally been fit and well. Yeah.
Mhm.
Okay. All right. Had you had any ideas? I mean, you mentioned meningitis before. Had you had any other ideas about what was going on?
No, I had no idea.
Okay. All right. And do you know if there's anything? Is there anything going around school, or she's got a brother? Is her brother well?
Yeah, he's fine. Yeah, everyone
Oh.
else in the family's absolutely fine.
Okay. And is there anything going around at school?
Well, I have
or-
actually heard a few of the parents say there's something going round, but I'm not sure what it is.
Okay. All right. Okay. All right. By the sound of things, what you've said to me, I'm fairly confident to make a diagnosis over the phone of something that we call parvovirus, or
Yeah.
some people call it fifth disease, or some people call it slapped cheek syndrome.
Okay, I've never heard of that.